Hot zone that is New Orleans, the city with the highest death rate in the country. Streets typically vibrant with music and tourists empty tonight. Meantime, the hospitals are filled and rapidly running out of supplies. 15 years after Hurricane Katrina, residents are hunkered down once again in their homes, weathering a radically different storm. Our Marcus Moore reports.
The narrow streets of New Orleans are empty. Boards block the sun rays that ordinarily would shine right into the now shuttered stores and shops here. The balconies above, lonely. And the unmistakable sound of New Orleans, the birthplace of jazz, silenced. It was much like this 15 years ago, when Mother Nature's fury came in the form of Hurricane Katrina. Today, the city is enduring a different kind of storm, this one invisible, but no less crippling nor vicious. And the healthcare workers on the front line of the raging war against COVID-19 are embroiled in the struggles of a city on the precipice of catastrophe once again.
And each day you think, okay, is the hurricane here? Is this it? And you don't know if this is it and it's going to be a Category 3, or if it's coming and it's going to turn into a 5, or we don't know.
Louisiana is one of the epicenters of the global pandemic. More than 14,000 cases reported so far across the state, most of them right here in New Orleans, this city known for its charm and attitude. The virus has killed at least 512 people statewide, the death toll up 38% over the weekend. One economics professor telling the Wall Street Journal the virus is killing 38 out of every 100,000 people in New Orleans. That is nearly twice as much as New York City. And in their fight to save lives, healthcare workers warn of the potential for the hospital system to be overwhelmed by cases. It's the reason the city's mayor and Louisiana's governor have ordered residents to stay home.
At this time, we need you to stay at home.
The obvious question is why? Why so many cases in Louisiana and this remarkable city? Health officials fear that Mardi Gras, that brought thousands of people right here to Bourbon Street, may have helped to spread this highly contagious virus. Now, the tourism industry the city depends on for about 240,000 jobs is left stagnant. And life in the Big Easy is getting harder every day.
Being inside as much as possible has been unfortunate. We're right in the middle of crawfish season. Normally, this is when you're going to boils all the time.
But as the local economy, like in so many other cities, hemorrhages jobs, doctors at Ochsner hospitals describe an onslaught of coronavirus cases. Every single ICU bed at their West Bank hospital is taken, the patients all suffering from COVID-19. The convention center once again being transformed to take care of the needy. A virus that discriminates neither by race nor age.
We've intubated 23-year-olds. We've put 27-year-olds on the ventilator. One of the sickest people I've seen since this all began was the nicest 42-year-old manager of a hotel downtown. And he just came in feeling kind of tired. I'm just tired, Doc. I just feel tired. And he was on a ventilator within about 24 hours.
24 hours.
Yep.
And as they meet the challenge every day, they are faced with the real possibility that they themselves could get infected.
It's a scary time for everybody. I think that it's scary because we are seeing so many of our patients get so sick. It's scary because we recognize that we may ourselves get sick. And it's even scarier knowing that our friends and our family and our loved ones have the potential of getting sick as well.
The enormity of it all is exhausting, often working 14-hour days. The losses are just as taxing.
Seeing the numbers of patients that are getting so sick so quickly does impact us, both physically and emotionally. You know, it's psychologically draining at times. But once again, we understand that that is our duty. And so I think that we in healthcare are going to continue to press on. We're going to fight the fight.
They certainly know about fighting in this city after having endured one of the most devastating storms in recent memory.
I think it's actually worse than Katrina, given the uncertainty, given the nature of, how long will this go on, the acuity of patients that we're seeing in our hospital. It certainly is a big challenge for our nurses, a big challenge for our physicians.
But the doctors and nurses keep coming back. And much like 15 years ago, when the music stopped and the streets emptied, the floodwaters did recede. Many of the shops reopened, and life returned. A new fight threatens the city once again. But the belief here is this too shall pass. Marcus Moore, ABC News, New Orleans.
Our thanks to Marcus for that report.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.